Here are two important takeaways from this video. All new incoming students must turn in immunization records by the due date. Due dates are October 1st for incoming summer-fall students, March 1st for incoming spring students. You may find your records with your previous university, high school, parents, or doctor's office. Hi, welcome to George Mason University. As an incoming student, you are required to turn in your immunization records. All Mason students born after December 31st, 1956 must submit proof of compliance with the immunization requirements of the University and the Commonwealth of Virginia. If your records are not complete and turned in by the due date, you will be charged a late fee and a hold will be placed on your Patriot Web account. This means that you will not be able to register for next semester classes until your immunization records are turned in, the records are complete, and your late fee has been paid. All immunization records must be in English. There are two ways of proving immunization. The first way is you may complete parts 1, 2, 3, and 4 of the immunization record form. You may have the immunization record form completed and signed by your doctor or healthcare provider. Parts 5, 6, 7, and 8 must be complete. Even though your healthcare provider fills out the form, this does not mean the form will be considered complete. The immunization office will review the information provided and confirm that you have met the immunization requirements. The second way is you may complete parts 1, 2, 3, and 4 of the immunization record form and provide supporting documents for 5, 6, 7, and 8 if applicable. Supporting documentation may include proof of vaccination history or titer lab reports. A titer lab report is a blood test. If the titer lab report shows proof of immunity, no further action is required. If it is negative or no immunity, you will be required to be vaccinated. See Part 6 for more information about titers. Not sure where to find your immunization records or documentation showing your vaccination history? You can search for them by contacting your parents, your high school, a previously attended university, your doctor or healthcare provider's office, or your military records. If appropriate documentation is not provided, vaccines may be repeated or titer lab reports may be required to show proof of immunity. The student will have to pay for the vaccination or blood test. All immunization records can be submitted to any of the campuses listed on the immunization record form. The Fairfax campus is open all year long. The Arlington and the Science and Technology campuses are open during spring and fall only. Please clearly print your name and G number on each page of your immunization records and supporting documentation. You can submit your records one of three ways. Just remember the only campus open during the summer is Fairfax. 1. Mail your completed form and all supporting documents to any campus address listed on the immunization record form. 2. Drop off your form in person in the immunization office on any campus. 3. Fax your completed form and supporting documentation to. Please make sure to write your G number and name on each page of the fax. If you have any questions about immunizations, please contact the immunization office. You can call 703-993-2135, email immunize@gmu.edu, or stop by any of our 3 locations listed on the immunizations form. Part 1. This section should be completed by the student. Please use blue or black ink. Do not use pencil. Clearly print your last name, first name, G number, local address, date of birth, and the phone number that the immunization office can use to contact you if we have any questions. A United States address is required for all students, including international students. If you do not have a U.S. address at the time of completing this form, please leave this section blank. Part 2. Emergency contact information. Student Health Services asks for the name and contact information for someone we may contact on your behalf if there is an emergency. Please clearly print the person's name and contact phone numbers. Initial this section stating that we may contact the person listed. Initials must be written, not typed. Part 2A. Minor consent. Anyone under the age of 18 is considered a minor. This section of the immunization record form is only required if the incoming student is not 18 years of age when they move onto campus or begin classes at George Mason. If you are under 18, parental permission or the consent of legal guardian must be obtained to provide most types of medical care at Student Health Services. To avoid any delays that might occur in treatment, please have a parent or legal guardian sign the form, date it, and state their relation to you in this section. Part 3. Disclaimer. This section states that Student Health Services reserves the right to request supporting documentation of your immunization records, request a titer or blood test, and/or revaccination at your expense. Every student needs to physically sign and date this section before submitting. Part 4. Tuberculosis screening. At the top of each page of the immunization record form, please print your name and G number. All students must complete the tuberculosis, commonly known as TB, screening portion of this form. Please answer yes or no to the following questions by checking the appropriate box. 1. Were you born in a country where tuberculosis is endemic and will arrive or have arrived in the U.S. within the last 5 years? A list of applicable countries is listed on the bottom of the form. If you were born in one of these countries, please write the date of your arrival to the United States in the space provided in the country where you were born. 2. Have you traveled to or traveled within any of the countries listed on the form for 3 consecutive months or more within the last 5 years? If you have visited one of these countries, please list the dates you traveled and the length of your stay in the spaces provided. 3. Have you had close contact with anyone who is or was sick with tuberculosis? 4. Do you have any medical conditions such as chronic renal failure, leukemia or lymphoma, HIV infection, or any other immunosuppressive disorders? 5. Do you have any symptoms of active tuberculosis such as cough for more than 3 weeks, night sweats, fever, unexplained weight loss, and/or fatigue? 6. Have you resided in, volunteered, or worked in a high-risk congregate setting such as prisons, nursing homes, hospitals, or homeless shelters? If answers to all of the above questions are no, no TB testing or chest x-ray is required. Go to Part 6 of the immunizations form. If the answer is yes to any of the above questions, George Mason University requires your healthcare provider to complete Part 5, tuberculosis testing, of the immunization record form. Part 5, tuberculosis testing. At the top of each page of the immunization record form, please print your name and G number. This section may be required based on Section 4 of the immunization record form, the tuberculosis or TB screening. If required, a healthcare provider must fill out Part 5 of the immunization record form to document TB testing and/or chest x-ray results. Students who have had BCG are still required to have a TB test. If you have a history of a positive TB test, you will need to provide documentation of the positive history along with the recent chest x-ray report and/or treatment. Section A. If you have not had a TB test in the last 6 months, you will need to either have a TB skin test or a TB blood test. If blood test is done, please provide a copy of the lab report. If a TB skin test is done, we will need documentation of the date it was placed, the date read, and the results in millimeter form. Section B. If you have a history of positive TB skin test or a recent positive TB skin or blood test, you will need to provide documentation of a copy of the most recent chest x-ray report. Section C. If you have a history of positive TB skin test or blood test and have taken treatment, you will need to provide documentation. The immunization office will need the dates the medication was administered and the type of medication. Part 6. Required immunizations. At the top of each page of the immunization record form, please print your name and G number. This section needs to be completed by your healthcare provider, or you must submit documentation verifying each vaccine. Tetanus diphtheria is a required vaccine. Provide documentation of either a Tdap, tetanus diphtheria pertussis, or TD, tetanus diphtheria shot, within the last 10 years. If you have not received this vaccine within the past 10 years, you will be required to get a booster shot. You can get this vaccine at George Mason Student Health Services or with another healthcare provider. MMR includes measles, mumps, and rubella. MMR is a required vaccine. 2 doses of MMR are required. They must be given at least 1 month apart after your first birthday, or you need to have received the individual doses of measles, mumps, and rubella vaccines administered after your first birthday. If you do not have proof of measles, mumps, and rubella vaccination, you may present a titer lab report, which is a blood test, indicating immunity. If any part of the titer lab report does not show proof of immunity, you will be required to get 2 doses of MMR. You can get a titer lab or MMR vaccination at Student Health Services or with another healthcare provider. Hepatitis B, HBV. You have a few options with this vaccine. You can provide documentation showing you received the hepatitis B vaccine, or you can provide a copy of a titer, a blood test, indicating immunity, or you can sign a waiver form to let the immunization office know that you do not want this vaccine. Student Health Services strongly recommends you receive the vaccine. However, the waiver is located on the last page of the immunization record form. Meningococcal. This vaccine provides protection against meningitis. Students have a couple options. Provide documentation showing you received the meningococcal vaccine, or sign a waiver to let the immunization office know that you do not want this vaccine. The meningococcal waiver is the last page of the immunization record form. The vaccine must be administered between the ages of 16 and 21. If the vaccine was administered before your 16th birthday, you will need to have the vaccine repeated or sign the waiver. Part 7. Recommended vaccinations. At the top of each page of the immunization record form, please print your name and G number. These immunizations are not required by the university but are strongly recommended. Varicella. This vaccine provides protection against the chickenpox. 2 doses at least 1 month apart are required for immunity, or a positive titer. Blood tests can show proof of immunity. Human papillomavirus, HPV. This vaccine is available to both men and women and is given to prevent infection with human papillomavirus, known as HPV. HPV can have symptoms such as genital warts and can cause cervical cancer in women. Hepatitis A. Hepatitis A immunization is not required but highly recommended. Part 8. Healthcare provider information and signature. Your healthcare provider must write in and sign Part 8 of this form if the healthcare provider fills in or transcribes the immunization record form for you or gives you any needed vaccines. If this document is not signed by a healthcare provider, you must attach a copy of supporting documents. Waivers. You will find the waivers for hepatitis B and meningitis on the last page of the immunization record form. These waivers state that you do not wish to receive the hepatitis B vaccine and/or the meningitis vaccine at this time. It is highly recommended that you get the vaccines. Even though you sign the waivers does not mean you cannot change your mind and get the hepatitis B and meningitis vaccines in the future. Exemptions. Medical. If you are exempt from receiving any of the required vaccines because of health or medical concerns, you must submit a letter from your healthcare provider explaining your situation. You must also submit Parts 1, 2, 3, and 4 of the immunization record form. Religious. If you are exempt from receiving any of the required immunizations because of religious reasons, you must submit a CRE-1 form. This form cannot be faxed. You must submit your original notarized form to the immunizations office. You must also submit Parts 1, 2, 3, and 4 of the immunization record form.